Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Last week, the House Appropriations Committee approved its fiscal year 2026 appropriations bill on labor, health and human service, education, and related agencies. The bill is vital for global health programs at the CDC and the National Institute of Health. It includes emergency response to global disease and even global immunization. As of last week, there were a number of increased funds specific to rural health that would benefit our communities and hospitals over the next fiscal year. The new Rural Health Provider Assistant Program would support rural hospitals with what's known as the Low Wage Index, and the Financial and Community Sustainability for At-Risk Hospitals Fund would also provide technical assistance for hospitals who are at immediate risk of closure. Now, many other rural-specific healthcare funding has been listed in the bill for the state offices of rural health research, and policy development, such things as rural obstetric care, outreach programs, and there's so much more. I had a chance to dive into it. Some of them are applicable to rural hospitals like Hillsdale, others are not. But we are hopeful that we can continue to push Congress forward to making sure that we provide vital funding for rural hospitals across this country. Now, I hope to return to a storyline in the very near future where I can talk more about these bills and their passage. On to the damage report. Now, we've been reporting on state-directed payments since Medicaid was first threatened by the One Big Beautiful Bill. But now we're seeing forward movement on these threats. Last week, CMS issued guidance on the new limits to Medicaid, what are known as SDPs, reiterating that they cannot exceed 100% of Medicare rates in the states that have Medicaid expansion programs. Now, let me break that down. Many states throughout our union have expanded Medicaid, and many states hoped to be approved for the grandfather period that will cover the reductions up and at least through 2028. But these limits are still a considerable threat to the payment structures of our rural hospitals. Those hospitals that got in right under the radar of those will be exempted up to 2028. But it's those number of hospitals that remain in the balance that are questioning where will they be in this funding metric. So a lot to unpack there. Now, maternity care in the U.S. has been suffering deep cuts over the past few years, and it's only, unfortunately, getting worse as hospitals brace for these very deep Medicaid cuts. Overall, less than half of rural hospitals provide labor and delivery services as it stands today, and that percentage will continue to drop at our current pace. In fact, one in Michigan just closed in the Upper Peninsula. That rural hospital had to cease all labor and delivery for that community. That creates a shortage. And in those shortage areas, birthing services are not available. It is critically important to understand that these Medicaid enhanced dollars are essential for providing services to the most needed population in our rural communities. We can't stress it enough. The future of maternal health for America, it's looking grim, and we have to protect our nation's families. We encourage you, speak out, be a voice with us, lift our voices collectively to send a message to Washington and the respective states that we cannot accept these cuts to vital programs. Now, many more hospitals are eliminating services throughout the U.S., even beyond obstetrics. 6 Mayo clinics across Minnesota, rural health clinics in underserved areas, whether it's pediatrics, emergency care, and the list goes on. These vital services are being cut in communities that rely on them for their healthcare needs. Without them, both the hospital and the patients that they serve lack the access they need for a full continuum of healthcare. These are very devastating cuts to hospitals that provide safety net services to rural communities. Lift your voice. Be a voice today, standing firm with your hospitals in your corner of the earth. We would just ask, be a voice for the voiceless. And now for today's success story. Last year, a tornado hit Mercy Health Love County Hospital in Marietta, Oklahoma, along with several other nearby communities, killing 4 people and injuring at least 100 more as reported. In the aftermath of the storm, the hospital was way too damaged to continue operations. Its outpatient clinic was able to reopen within a few months later, but no other services were available to that community until this month, with a temporary 24-hour emergency room opened up to serve the local community. The ER, what is it? It's a modular building at the end of the hospital's clinic parking lot. But according to Mercy Health, this is the closest they've come to any type of normal operation since a tornado hit. We are proud of the work our fellow rural hospitals are doing, and we love to celebrate successes like this as struggling providers find creative ways to care for our communities. Thank you to our sources for this episode: KFF Health News, the National Rural Health Association, the Detroit Free Press, Becker's Health Review, and Mercy Health Love County.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.